You're watching New York One, news all evening. New York Living Health and Fitness Report.
If you've been considering LASIK vision correction surgery, but were concerned about the risks, listen up. There's a new technique that may considerably reduce the risk of infection and other complications. New York One's health reporter Cheryl Wills explains.
Philip Walkley, known on cable television as P.T. Walkley, has been anxious to have his vision corrected with lasers, but he was always a little apprehensive about it.
Yeah, I figured, I'd wait until it was at its safest, and I asked Dr. Dello Russo if there was anything really coming down the line that, is it going to get even better?
There was something coming down the line to make LASIK vision correction surgery safer, and Dr. Joseph Dello Russo is one of the first eye surgeons on the East Coast to use the new procedure. Here's what happens. Before even using the laser, surgeons first have to use something similar to a razor blade to get to the surface of the cornea. Doctors call it making a flap in the eye. That step alone can sometimes cause corneal scarring and blurred vision.
Most of the side effects are evolved from the creating of the flap with the blade. So we don't have to use the blade anymore, then we get rid of those side effects.
So now Dr. Dello Russo no longer uses the blade. He uses a new type of laser.
It should be dark now. We're going to move you under the laser to make the flap. We use this special laser called Intralace to make a very precise flap, and we avoid all the complications from that, possible anyway. With a blade, then we have a safer procedure.
After Walkley gets lasered for the flap, Dr. Dello Russo uses another laser called laser vision to reshape the cornea.
Way right there, don't go. So this is the laser that reshapes the cornea.
LASIK surgery is known for being quick, about 1 or 2 minutes per eye. But surprisingly, this two-laser procedure makes the entire process considerably longer.
Now we have to create the flap first for each eye under one laser, get them up, move them with the other laser, get them comfortable, get everything adjusted. So it does take twice as long to do the procedure, LASIK procedure now, than it did before.
The procedure now takes about a half an hour. People who have thin corneas may now be able to have LASIK surgery, but the eyes must still be overall healthy. And the use of both lasers makes the surgery pricier than before. For both eyes, the procedure can run about $5,000. In Manhattan, Cheryl Wills, New York One.